Hi, everyone. I'm Adam Chu, and I'm a project director at the Education Development Center, which is home to the Zero Suicide Institute. This is a brief tracking and managing your data using the data dashboard session. And I also want to recommend viewing the Zero Suicide, the outcomes session when you have a chance, if you haven't already, because it'll be a nice supplement or context providing piece to what I'll be saying in my short piece here. But before describing the dashboard, I just want to provide some additional contextual remarks about the need for the data dashboard and the need that it's responding to with respect to suicide prevention data in clinical settings more broadly. So although it was back in 2012 that the National Strategy for Suicide Prevention named suicide prevention as a core responsibility of healthcare settings, which really underpins the early stage development of the zero suicide framework, there still today remains a significant room for improving and for improvements in data collection and accountability in health and behavioral healthcare delivery. There's a continued and necessary emphasis on tracking outcomes, such as suicide attempts and deaths, which are, of course, of huge interest at many levels, not only systems, but the federal, state, and other levels. But we also need metrics that are more specifically tied to care activities that align with the clinical care and the clinical pathway that exists within the zero suicide framework. And so those kinds of metrics are equally critical so that systems know what is or isn't happening for the clients who they see who are at risk of suicide that do happen to enter into these systems. So we know many people don't enter into systems who are at risk, but among those who do, it's sort of incumbent on us to know what we're doing and whether the care that we intend to be providing is actually happening. So we need to know whether we're doing what we said we would do, essentially, or what we set as our standard work for suicide prevention. Is that actually happening? And what impact on the care the care provided is that having? So in other words, there's room for improvement in and a need for building capacity of healthcare systems to collect this continuous quality improvement data and then use it over time to improve care, because that's ultimately what we want to see happen. It's not just about getting the numbers, it's about doing something with them to improve the care that's being provided. Implementation science suggests that you need to be very specific in what you're trying to do, measure those activities consistently and over time, train people to do those activities well and with fidelity and with high quality, and then continue to emphasize those activities, such as by supporting the people carrying them out, through refreshers or supervision or otherwise, and also monitoring whether they're following through what they're supposed to be doing. And that's really what these sort of clinical, quality outcomes are about. So while there are many systems, quote unquote, doing zero suicide to varying degrees, we still don't have a robust accounting or a robust set of data about the commonly implemented activities that are a part of the zero suicide framework. So those would include things like suicide screening, suicide risk assessment, safety planning, counseling on access to lethal means, and then the impact that has on the care being delivered within an organization. It is also important for a specific system, of course, so not just this collective set of do we know what the broader array of systems implementing zero suicide is doing, but for an individual system, it's really important for them because we don't know what we're doing if we don't know what to improve and how to make informed adjustments. So we need to measure what we're doing, we need to know where there's gaps, and we need to make some improvements. And for an individual system, that's really important, in addition to it being kind of important for the broader world of zero suicide that's out there, that's happening in the field right now. So let me step back in towards the data dashboard that I mentioned in the beginning. It was built for the purpose of supporting systems and providing better data-driven care to improve the quality of the suicide prevention services they provide. And I think that's really the key piece to remember. The dashboard is the means, it's not the end, or any dashboard is the means, it's not the end, really. The intent of the dashboard is ultimately to provide guidance to systems in improving the care provided to people who are at risk of suicide. The Zero Suicide Data Dashboard is a freely available and publicly accessible resource that organizations can use to enter, edit, and monitor their data on the implementation of key clinical components in the Zero Suicide framework. Our hope is that the dashboard helps organizations use standard defined metrics when reporting their data and doing that consistently over time, with the hope that augments or fills gaps, perhaps in their current data collection and reporting structures, or maybe they don't have as robust a structure compared to what they want or what they need, and perhaps the dashboard helps fill that gap. again, the goal is to help organizations better understand the care that's being delivered to people at risk so they can do it better and continue to improve. We know from, a decade of zero suicide implementation in the field that the improve elements and this whole continuous quality improvement and collecting data, both the attempts and death data and the data on specific clinical activities, is the biggest challenge that people have and that systems have. And it is both, a key piece of zero suicide that sets it apart from other, improvement or, collection of best practice implementation. It's the systems level data collection that really makes zero suicide different in terms of it as an overall framework. And so we really need to try and help people lean in on this a little bit more, especially a decade in. And so you can find this dashboard on the Zero Suicide website, zerosuicide.com. It's in the key resources section in the main resources area. And, we invite you to check it out. Again, it's a free available public resource that anyone can use. And so we hope you will take some time to peruse through, and there'll be more and more pieces added to it as time goes on. So I think in summary, we have some knowledge about impact, some published, which maybe you heard about if you saw the outcome session earlier, and some of it's also anecdotal. And there are also things like the zero suicide outcome stories that you can find on the Zero Suicide website as well. And so at this point, we need something that can help systems track what they're doing clinically within the context of zero suicide, help them do it over time, and we hope that the dashboard accomplishes this. Thanks very much for your time.